Sleep plays a crucial role in our overall well-being, affecting our immune system, mental health, and cardiovascular health, among others. Despite this, a large number of people experience sleep disruptions every year. According to the National Heart, Lung, and Blood Institute, between 50 to 70 million people worldwide are currently experiencing some form of sleep disorder. Among these people are individuals with autism spectrum disorder. In this segment, we will explore the challenges that people on the autism spectrum face when it comes to sleep, the potential causes, and proposed treatments. Now, before we can dive further into this topic, we need to look at what an autism spectrum diagnosis entails. According to the American Psychiatric Association, autism spectrum disorder, or ASD for short, is a complex developmental condition involving persistent challenges with social communication, restricted interests, and repetitive behavior. Despite this definition, autism can be experienced quite differently between individuals, as these challenges may vary in the degree to which they may be present in each person. According to the Center for Disease Control and Prevention, the prevalence of ASD in 2023 was shown to be approximately 1 in every 36 children, or about 28% worldwide. This presents a large increase compared to the prevalence rate reported in 2000 of 1 in every 150 children, or 0.6% worldwide. People diagnosed with ASD may also get diagnosed with anxiety disorders, attention deficit hyperactivity disorder, or ADHD, mood disorders such as clinical depression, as well as language and motor difficulties. While this list is not exhaustive, it gives us an idea of how treatment may have to vary from person to person depending on their experience with ASD. It turns out that a large percentage of people with ASD also suffer of sleep disturbances. Several studies have shown that this rate can be anywhere between 50 to 80%, compared to a much lower prevalence rate of 9 to 50% amongst neurotypical children. While these problems may usually co-occur in children with ASD, they tend to persist or worsen over time. While there's a plethora of sleeping disorders listed in the International Classification of Sleep Disorders, there are two main types that seem to be most often found in people with ASD: insomnia disorders and parasomnias. One of the most common sleeping disturbances a person with ASD of any age might experience is insomnia. This can range anywhere from having settling problems or waking up sporadically throughout the night to be unable to sleep at all on some occasions. When someone has settling problems, it means they might have more difficulty falling asleep. In the case of ASD in younger children, these could stem from inappropriate bedtime routines, anxiety, or oppositional behaviors. As they grow older, however, people with ASD might find themselves suffering more of sleeplessness more than anything else. Parasomnias, while still common, tend to mainly be present in children with ASD, although they may still manifest in a smaller concentration as the children age. According to the reports made by parents of children with ASD, the parasomnias these children tend to experience are mainly nightmares. In a recent study by Mukhal et al., some recurring themes in these nightmares were death, injury, and other types of violence, as opposed to their typically developing peers who were more likely to have nightmares of dogs and insects. Furthermore, children with ASD would also be more likely to report nightmares of themselves being injured, while typically developing children would report nightmares of their loved ones being injured. This would be consistent with the current understanding of people with autism usually having a different self-awareness perception compared to neurotypical people. Among other parasomnias, children with ASD might also tend to experience what seem to be night terrors, although this still lacks conclusive evidence, as these are usually assumed from parents reporting their children waking up screaming and crying abruptly. Overall, it is still fully unclear why people with autism might report sleeping disturbances, though several potential mechanisms at play may include both biological factors and psychosocial factors. Abnormal melatonin synthesis rates and dysregulated circadian rhythms have been found to be present in people with ASD in many studies. Melatonin is a neurohormone critical to the organization of circadian physiology. With the help of zeitgebers or time givers, melatonin may influence sleeping time, the principal zeitgebers being light or the lack thereof, food, activity, rest, patterns, and social cues. It is suspected that sleep disturbances among children with ASD may occur due to difficulties interpreting social and communicational cues that would act as zeitgebers. These zeitgeber misinterpretations, with the addition of abnormal expression of clock genes, would lead to an atypical circadian rhythm. Studies such as those of Bourgeron and Nicolas et al., identifying specific clock genes such as PR1 and NPAS2 as being involved with abnormal circadian rhythms in people with ASD, further solidify the biological hypothesis. On the other hand, psychosocial factors can also have a significant impact on sleep disturbances among people with autism. Unfortunately, this area of study is generally neglected and there is not much conclusive evidence as of now. However, some literature such as that of Osvana et al., Tani et al., and Wiggs and Storrs propose that comorbid psychopathology such as depression and anxiety might be associated with sleep difficulties in people with ASD. More specifically, it was found that insomnia disorders were related to higher rates of anxiety, while settling difficulties and frequent night waking could be related to mood disorders, anxiety disorders, and ADHD. These relationships do not go only one way, for several studies have shown that sleep difficulties and thus fewer hours of sleep can negatively affect ASD symptoms socially and cognitively. Treating sleep disturbances, no matter the type of their origins, is crucial to improving quality of life, and this goes for people with ASD as well. As of now, non pharmacological treatments to improve sleep routines include having a strict bedtime routine and daytime routines, including physical exercise. Additional behavioral therapy can be used in cases that have ruled out other medical disorders as being the origin of the sleep disturbances. One such technique would be extinction, where the parents would withdraw from giving attention to behaviors that discourage sleep in order to let the child some time to self soothe or eventually fall asleep on their own. However, these types of treatments are often also paired with medication acting on the melatonergic pathways or melatonin therapy. It has been shown that in low doses, melatonin supplements can be beneficial in helping to normalize sleep patterns. It is now known that children and adults with autism are highly susceptible to sleep disturbances, yet much remains to be researched on the causes and treatments for such cases. Going forward, it would be important to consider how these sleep disorders can be treated, as doing this may contribute to reducing other symptoms in children and adults with autism spectrum disorder. Thank you for listening.